the hemoglobin, the higher your A1c is going to be. Just know that is how it is read and put together. Because again, it's an average, right? Your chance of ending up with type 2 diabetes.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Coach and our supplement range Cargenesis. And I am joined again today by the amazing, beautiful Kelly Song. So I thought today we would talk about HbA1c and what that means.
So let's start with what is HbA1c. So that stands for a hemoglobin A1c. What it means is it's about the sugar molecule or the glucose and how much it attracts or sticks to the hemoglobin molecule in the blood. Okay. Yeah. So the more sugar that attaches to the hemoglobin, the higher your A1c is going to be. Okay. So
it's all about this, right?
Exactly. So your hemoglobin A1c is an average blood sugar. It is over a period of time of 3 months. So think like a batting average in baseball. Okay. It is an average. Now they can use the A1c or the hemoglobin A1c to diagnose you with prediabetes and diabetes. So a normal A1c, and it's always comes in a percentage. So when you see a percent, just know that is how it is read and put together. Because again, it's an average, right? So a normal A1c is going to be anything under 5.7. So 5.6 or lower is going to be absolutely a normal A1c. Now, if it runs 5.7 to 6.4, that's going to be prediabetes. So that means your chance of ending up with type 2 diabetes is very strong in the next 3 to 5 years. So it's kind of like, this is going to age me, but there was a show called Lost in Space and there was a robot and he'd go, "Warning, Will Robinson, warning." It's kind of your warning, Will Robinson moment. Okay. So it's time to make those lifestyle changes so you can avoid being diagnosed with diabetes. Unfortunately, once you're diagnosed, you have it for life. You might be really controlled. You might be in what's called diabetes remission, where your A1c comes under 5.7. That's diabetes remission, and you're off your medications, but you still have diabetes. It is a progressive disease that is not curable at this time, but it can be extremely well controlled. Okay. Now, good, the bad, and the ugly. This is an average. If your doctor does some blood work, right? They do a comprehensive metabolic panel, pretty common thing to get. You're going to have a glucose on there. Well, if you didn't fast, it's not going to tell us all that much. No. But if you were fasting because you had your lipids done, and if that number is over 120 at 126 or higher, and they do that test twice, they can diagnose you with diabetes with that as well. So those are all indicators or markers to officially diagnose someone with diabetes. So if you're seeing those and it was a fasting, then yes, we're starting to have elevated blood sugars. Okay. Our body should normally regulate that if we don't have any blood sugar issues going on. Now, the American Diabetes Association and many of the diabetes organizations out there have a standard of keeping your A1c under 7.0. As you go above 7, you increase your risk for diabetes complications. So a few of those would be blindness, amputations, cardiovascular disease, strokes, heart attacks, those kinds of things.
Yeah.
Neuropathy, which we've talked about in the past, is a really horrible nerve pain, especially in your feet and your hands. So again, anything above there is increasing the risk. So, but if you're starting at let's say a 9, every time you reduce that by 1%, you're greatly diminishing your risk for complications. So if you have a little ways to go, don't freak out. Complications don't happen overnight, it happens over time. So just work on getting that down. Now, I say the standard is under 7. However, depending on your age and your medical diagnosis, you and your healthcare provider are going to set personal goals. For example, if you're 80 years old and you have a history of falls, under 7.0 may be too low because of risk of low blood sugars, which could cause you to fall. So that's just one example of someone who may have a little higher and maybe an over 7 goal because of their situation. Okay. So definitely want to talk with your healthcare team about what your goals are. But remember, this is an average blood sugar over 3 months. And by the way, if your goal together with your provider is 7 or less, until that is 7 or less, you should be having that done every 3 months until you get it controlled. Most insurance out there will pay for you to have that done every 3 months. Okay, in the United States. So that's a pretty standard practice.
If you want to know more about what we do, head to www.kidneycoach.com. All our supplements are there as well. And you can also head to our Facebook page, our Instagram page, all of those sort of things. And it's all there as well. Make sure you hit like and subscribe. That way you'll get notified anytime we put out new videos. Kelly, thanks for being imperfectly perfect to you. I will see you next time. And I want to thank everyone for being part of our community. We'll see you next time. Bye.
Bye, everybody.